I'm Jennifer Zelevitsky, and I'm a certified menopause practitioner. And today I want to talk to you about testosterone because everybody's asking about it, and they're asking with a sense of almost panic, like, am I missing something super important if I'm not on testosterone? So I want to reassure you that testosterone has been studied quite extensively by Dr. Susan Davis. And if you're not following Professor Susan Davis, go follow her now if you want the real deal on testosterone. But what I see in my practice from prescribing it is very much in line with what the evidence shows, which is that for hypoactive sexual desire disorder, and we'll define that a little more carefully in a second, it can be helpful for about 60% of women, but there's no consistent improvement in mood or muscle mass or bone density. The reason is a lot of our testosterone comes from our adrenal glands. So unlike estrogen, which really takes a nosedive at menopause, testosterone, we seem to have pretty consistent levels until we're a little older. Anyway, having said that, it can be useful. But what I need you to understand is that we're not doing a good enough job of normalizing libido at perimenopause and beyond. It is perfectly normal, and I can't state this enough, for that drive, that biological drive from ovulation to get your egg fertilized, that dwindles at perimenopause. It has to, right? Because you're not ovulating anymore. But there becomes this distinction between spontaneous libido, which is that in your 20s and 30s kind of sitting around thinking about it, to your 40s and beyond, which can look more like something called responsive libido. And what is responsive libido? It means you have a bit of a sort of a neutral mindset about intimacy. Like you can fine without it, but you're also very open to it with a loving and supportive partner. And when you're in the moment, things respond as per usual. So I sometimes say to women, are you like dead down there no matter what? Or are you alive? If they're alive, I really try to say, let's try to normalize this rather than jumping on the testosterone bandwagon. If they're dead down there, testosterone might be a good idea, but it doesn't work for everybody.